Pregnancy can bring more than a baby. It can also be the beginning of problems with your pelvic floor muscles, which can result in incontinence and other issues. But help is on the way in today's webcast, Pelvic Health and Pregnancy. Discussing today's topic is Dr. Lisa Rogo-Gupta. Dr. Rogo-Gupta is a clinical assistant professor of obstetrics and gynecology and takes a multidisciplinary approach to women's health care. For over a decade, her patients have benefited from her expertise in areas from pelvic organ prolapse to urogynecology. Dr. Rogo-Gupta has received multiple teaching awards throughout her career and is board certified through the American Board of Obstetrics and Gynecology for female pelvic medicine and reconstructive surgery. Welcome, Dr. Rogo-Gupta. Dang, I did so well up until your name.
No problem at all. Thank you so much for the lovely introduction, and thank you for inviting me here today to talk to you about pelvic health and pregnancy. So to begin, I talk a little bit about anatomy. So I know that most of the language that I use isn't part of your day-to-day, and human biology probably was a few years ago. So I try and get you a little bit up to speed with the words that I use. That will help you to follow along with today's presentation. It will also help you as you read more, preparing for your own potentially pregnancy and delivery, and so that when you talk to your obstetrician, gynecologist, you can ask thoughtful questions that are specific to the questions that you truly have. Then we'll go on to talk about what to do before or while you're pregnant, and about some common pelvic floor related conditions that can happen after delivery. We'll finish off by talking about basic pelvic health and your future, and maybe some simple exercises and things that you can do at home. So first, again, anatomy. So anatomy is going to be that basic body structure, and the human body is engineered for reproduction in a historic sense. Now, evolution is a slow process and changes happen over time, but as you can imagine, the bones are sort of that foundation. The bones stabilize us as we stand on two legs, right? You can see that connection, but they also help protect our vital organs that are inside. They are the same. For example, here's the pelvis, and the female and the male, you can see the same basic structure, but there's some differences. The female's opening in the pelvis is wider to allow for passage of that fetal head. So that's interesting, isn't it? I told you that this was the foundation, and yet there's a hole in the foundation. Would you ever build a structure with a hole in the foundation? Probably not. And interestingly enough, nature filled that hole with something soft. So it's a bowl of muscle that spans through that whole foundation from side to side and front to back. Through this soft filling of the hole, your urination must occur, you must have a bowel movement, you must have sexual intercourse, and deliver a child. There's a role in these muscles in sexual sensation as well. If you remember a little bit from high school biology, you'll remember that muscles are much softer than bones, and they're much more, therefore, prone to use injury, to sprain and strain. Again, kind of an interesting filling for your strong foundation. They also do a lot of work in terms of stabilizing your joints, right? Like the little braces that help connect those joints together. So, if you think about it, we ask a lot of this foundation and of these parts, right? We go from one extreme of physical activity, of being very sedentary, to another, running marathons. We're living much longer than we ever have in human history. We are having children and having them later. We've developed medical conditions that humans have never had. So it's actually really easy to forget how much we put our bodies through. That's why there are pelvic health specialists, and that's why we're out there trying to talk to people all over the world about how important it is to treat your body kindly as you go through this very important time in your life. I've said this many times before, and I'll say it again. The engineering work here leaves a lot to be desired. So if any of you out there have a better way, I'm very interested in talking to you. Come find me. So I talk a lot about the pelvis, but what about the abdomen, you might say? Where does this all begin and end? So the abdomen is sort of that continuation, that part that sits on top of the pelvis. And you have your abdominal and your spinal muscles that help support those organs and perform the stability of everything, right? All together as one group. there's also the necessity to maintain a particular pressure inside your body for all of your organs to work correctly. And I use the analogy sometimes of like a soda can or a pressurized can. You know that if there's too much gas buildup, it's got to come out somewhere. Or think about yourself. Have you ever felt bloated or full? And what happens? A little bit of gas might escape from the top. It might escape from the bottom. Now imagine being pregnant and growing a human being where the pressure is just rising and rising and rising, and you don't get any relief until the day you deliver. So please take pity on any pregnant person you see walking down the street. It's quite the challenge. So let's test your knowledge about those pelvic floor muscles. So during breathing, so something you've done every day for as long as you've been on this earth, do your pelvic muscles remain fixed because you breathe with your diaphragm? Do they lift? Do they descend? Do they descend and lift? When you inhale, your pelvic floor muscles actually descend. And when you exhale, they lift. So think about that. Part of what I like to do is help draw awareness. So even if you aren't personally planning to become pregnant, just knowing what happens in your whole body is very important. So then perhaps you've decided to become pregnant. And this is an incredible phenomenon in and of itself. Obviously, I'm biased as an OBGYN by training. I find it very fascinating. I think you should too. But there's a tremendous workload on your abdomen, your spine, and again, your pelvic floor. Not only does that happen, but your hormonal shifts actually cause these tissues to soften and to stretch to prepare for this birthing process. And some of these changes are long lasting. And quite frankly, you never return to your pre-pregnancy state. So once you've made the decision to become pregnant and potentially to deliver, you will be changed forever. We can't bring you back to before. And isn't that interesting? You're preparing for the hardest physical task that you've ever had to do, and yet you're becoming softer and stretchier and putting yourself at risk for a higher injury. That's not how you would train for a marathon or any other type of a physical activity, right? But that's what happens in pregnancy and delivery. And again, just to bring awareness to how serious this process really is. So delivery has tremendous changes also. Separate risks or different processes. Vaginal delivery will traumatize your pelvic floor, the muscles, the tissues, the nerves, but C-section traumatizes your abdomen. So all women are kind of at risk for problems regardless of how you deliver. So I'm sorry to deliver that news, but you can't get out of it scot-free. And natural does not mean risk-free. So that's something I talk about a lot in my practice, the assumption that if you deliver naturally, that there's no risks, and that just is not the case. So again, if anybody out there is very interested in designing a program of the modern stork, where the baby gets delivered to my doorstep and I don't have to be pregnant or deliver again, I'm very interested in your beta testing, so please find me after this show. So now that we've talked about the anatomy and you're sort of up to date on those words, let's talk about what to do before or while you're pregnant. Now, I'm making an assumption that because you're logged in today, you're somebody that wants to know. You're somebody that wants to be prepared, that you like to use knowledge in your preparation process, and you've been quite successful in your life. You've gotten to where you are now because of that strategy. And while I can respect that as an educator and a physician, I have to tell you, as a human being, you cannot outsmart pregnancy. You can do all kinds of things to help prepare and optimize the outcomes as much as you can. You can talk to your obstetrician gynecologist as soon as possible about these issues, but nature is part of the equation, and nature doesn't listen to you, unfortunately. So it's a very important thing to realize that there's some things that are out of our control. So let's talk about how to make these processes as smooth as we can. So I'm going to try and give you some tips today, because if you forget my name, if you forget the anatomy, I'll forgive you for all of that. But I would like to give you some little tips and some truths that you can use as you go back to your obstetrician gynecologist and start having this discussion about what pregnancy and childbirth may mean to you and your body. So first, I recommend and advise that you establish realistic expectations about childbirth. There's a lot of misinformation out there in this day and age, the extremes of what can happen. But one truth is that stretch injury to your muscles and nerves will occur. And the longer you push, the higher the risk. So one thing that's very much in vogue and is a conversation that goes on is trying to push as long as possible to facilitate this natural childbirth. And I just want to make sure all of you listening are aware that that comes with a cost. The longer you push, the higher the risk of some injury. Second, you can't escape genetics. Many experts think that some women may have less muscle and tissue preparation during their third trimester, and that may be why some women tear and some women don't. Damage occurs in the first delivery in about 1 to 4 out of 10 women. So even if you are planning to only have one childbirth, you could still have some damage. Another truth is that vaginal walls tear, and we don't count stitches. Don't ask us, we're not counting, doesn't matter. But we do look at the depth because we are interested in the organs that are surrounding this area. There's also something in between cesarean section and a natural delivery. It's called operative vaginal delivery. This happens when your body doesn't generate enough force to be able to deliver that baby naturally on its own, and your obstetrician gynecologist will help guide the baby out, either using a suction cup or some metal spoons. That might be a good thing to talk to your obstetrician gynecologist about while you are pregnant, because it may have some different impacts on your risk for the pelvic conditions after delivery. Another important truth is you can't guarantee a vaginal delivery, so don't ask us to guarantee that either. It's not possible. But again, you can try and optimize things and have that conversation early. After a natural delivery, you may have more urine leakage, for example, but again, cesarean section doesn't completely protect you from problems. One thing that you can do is you can try and have your children younger. If you're listening to this webinar and you are on the younger age, or perhaps in your 20s and your life is otherwise ready for childbirth, that is one thing that we know can help decrease your risk of some pelvic problems after delivery. So now moving on to my second piece of advice. Know what is common after childbirth. We talk about this fourth trimester, when changes in your body may include lack of sleep, fatigue or feeling tired, stress, pain, urine leakage, lack of sexual desire, mental health problems, breastfeeding problems, or more commonly, all of the above. And that's not something you're probably used to. So I think it's also very good to be aware of these things ahead of time and talk to your social support, your family, about what might happen and what things you would like to have them do or have ready to help support you during this very challenging time. During the first year, here's common changes to your body that you might notice. The vagina hanging low, urine leakage, gas leakage, or bowels leaking. If you notice that these things are happening, for the most part, don't fret. There are some concerning features that you'll talk to your obstetrician or gynecologist about. Our organization has recommended talking more so with your obstetrician gynecologist in those first days and weeks following delivery to make sure that your concerns are answered and that you're on the right track and within normal limits, as we say. But most of these things that I'm listing will resolve within that first year. So patience is a virtue. We're also trying to get away from the conversation of the expectation that everything is magically better within weeks or months of delivery. Now with social media, you see extremes of women returning to their pre-pregnancy figures, out on the beach, at full speed working, just like they did before they delivered. I personally think that's a very dangerous expectation to set. I think if you're listening from other countries, you may be familiar with different ways that we look at the postpartum period. But we're trying to do a little bit better in making women understand that the changes in their body could take longer than just this traditional 6-week conversation, and that's okay. But being patient is a big part of it. If you wait 5 to 10 years, for example, as we're following women out longer, many of those changes will disappear will resolve or significantly improve, like the vagina hanging low that goes down by quite a bit and the accidents of bowel. So again, patience.
And the percentages are the percentage of people who have those things?
Correct.
Okay.
Now, what can you do to help optimize these things? My other pieces of advice. First, or third, take care of your body. So what does that mean? That means to try and avoid or reduce irritating items. For example, soda, smoking, just stop doing it. There's no benefit really. I know that sodas can taste good and whatnot, but soda and tobacco, those are things that we can pretty confidently say, go ahead and cut those out. There's some other things in your diet or environment that you may find irritating. Not everybody does, but you may, such as caffeine, alcohol, artificial sweeteners, carbonated drinks, spices, citrus. So if you're somebody who tends to notice that these things irritate your bladder or your bowel, find that out now, perhaps before you become pregnant. Again, so you can optimize and make life easier on your body as you're going through all those other changes afterwards. So there's other things you can do. What does optimize your body function mean? So yes, fiber. We're all tired of hearing about that from our grandmothers, but it is true. You really want to optimize your bowel function so that you have soft movements that come on a regular schedule that are not painful. And again, along the lines of things that we take for granted until our body stops working, this is one of those things that if it's already not working perfectly for you before you become pregnant, it's not going to magically become easier afterwards. So get that in control now. Talk to your general practitioner or your internist about this. Get moving, strengthen. So if you are sedentary at work, start taking regular breaks about every 2 to 3 hours. Walk, use the restroom, or have meetings while walking. If you have the ability to get a sit-stand desk, or if your company provides occupational or physical therapy consultation as part of your workplace environment, I recommend you take those consultations. Very helpful. Don't work from home sitting on the couch on a laptop. Take all of these into consideration on how your body moves, again, before you become pregnant. And weight control. So that's a very sensitive topic. If you're in the United States, you know that our average weight has been rising for decades, and patients are sensitive about it. They're sort of tired of hearing about it. As physicians, we also want to be sensitive to how a patient feels about his or her weight. But it's actually really important. The reason we talk about it is it does have implications for your pregnancy and your delivery. So around this time, as we talk about pelvic health and pregnancy, I do like to mention about weight. So let's see how much you know about weight and pregnancy. So during pregnancy, should you gain A, up to 50 pounds? B, does it just depend on your pregnancy? Or C, as much as you want because you're pregnant? And pregnant women have cravings. What do you think? So maintaining the amount of weight gain that is recommended during pregnancy actually takes a lot of discipline. So if your weight before pregnancy falls into the normal weight category in the second row, it's recommended that you have a total weight gain in your pregnancy. So from your first weight check to the day of your delivery, between 25 and 35 pounds. Now, again, social media and the sources of information these days, you'll see the wide ranges of weight gain, but it is tough to limit your weight gain to 25 to 35 pounds. We're in a culture that likes to feed pregnant women. There is a wonderful feeling like I deserve this, I should eat, and I do not want to take anybody's joy away from them by any means. But I want you to realize that everything has a consequence. And we're very fortunate. Most of us have access to food. If you're listening to this webinar, it can actually appear on your doorstep using your app on your phone at any time of day or night. So it's very easy actually to go over this without that discipline. So that is my recommendation about weight. So now that we've talked about those things and I've sort of hinted at some of these conditions that can happen after pregnancy, I'll talk about them in a little bit more of level of detail. And yes, I apologize. I know a lot of the things that I talk about aren't your normal dinner time conversation. They're normal in my house. But hopefully by giving this talk, it will encourage you to open the lines of communication as well. So pelvic disorders refer to a wide range of conditions, and they can occur due to muscle weakness, high or low tone, we call it, or joint dysfunction. So those of you who are listening, I'm going to make the assumption that many of you are in this age range, where about 1 in 10 of you are already suffering from one or more pelvic floor disorders. Well, guess what? Time passes quickly, and soon you'll be in the next age range, where nearly 30% of women suffer from one or more pelvic disorders, and that percentage will go up over time. Now let me ask you, if you released a product and about 30% of them malfunctioned over time, would you continue production? Of course not. It's a very different way of looking at the human body, okay? We cannot stop production on the human body, and evolution is slow. So it's good for you to have eyes open and know what your body is going to potentially do over time. So what do you know? If you're listening and you are an American, are you at the highest risk of developing urine leakage, high blood pressure, depression, or diabetes? Those last three you're more than likely familiar with and you've talked about. If you've taken tests before, you will know that because I'm asking you this question, the answer is A. So it's more likely to happen to you than the other things that you probably have been educated about and is more part of your dinner time conversation at your family. So I hope that you realize that it is worth it, and I'm glad that you've logged into this webinar today. This condition is an expensive condition to also have. It has its implications. It's expensive to wash your clothes more often, or perhaps to buy absorbent underwear or liners, undergarments. We also know that urine leakage has been rated the #1 most embarrassing health issue by United States women. So it can impact your desire for intimacy, your desire to exercise. You may feel embarrassed. So that's, again, why those of us in pelvic health really want to open those lines of communication and encourage you to talk to your obstetrician gynecologist early. What about what I said about the vagina hanging low? What does that mean? Well, remember how I talked about those soft muscles that fill in that foundation. So over time, if they are weakened or damaged, they're going to allow the organs they support to fall down. This one can happen without you even knowing, and that's okay, actually. This is not a dangerous condition in the most part. In fact, nearly half of women over 50 have some component of this, and they don't even know it. Again, that's okay. That's our job to be able to screen for things that are concerning. Someone might feel heavy, they might feel a pressure down there, or they may have difficulties with intercourse or going to the toilet. So that's what that means, and that's why I talked about the soft muscles in the base of your foundation. Gas or bowels leaking means that you might not be able to control when you have your bowel movements. If you are somebody who already has issues with the consistency or speed at which your bowels travel through your system, I would encourage you to, again, talk to your internist ahead of time before you become pregnant or deliver, when then you've added on muscle or nerve damage. About between 6 and 15% of adult U.S. women may have these types of accidents, and about 20% of people who have inflammatory bowel syndrome. So if you have that, just again, start the conversation earlier would be my recommendation. And lastly, prepare for battle. Engage your core. Be ready. In terms of the types of activities you do, the daily ones like standing, lifting, going up and down stairs, but then also for those things that happen less often sometimes, for coughing or sneezing. Okay, so most people have heard about these Kegel exercises. What are they? So I like to talk about it a little bit in terms of things that you might be able to do at home on your own to prepare. Now, they only work if you hit the target, so it's target practice. So assuming you're listening to this webinar with headphones on, seated at a desk perhaps, you could join in with me if you'd like. You want to go ahead and sit with your legs uncrossed. You want to first take a deep breath to relax, and just remember that breathing relaxes that pelvic floor as well. Now see if you can hit the target. Can you squeeze your pelvic floor muscles? Not your abs, not your buttocks, just the pelvic floor. Some people will say it's like stopping your urine midstream, or if you felt like you were about to pass gas in public and you didn't want it to happen. You want to squeeze for about 3 seconds, release for 3 seconds, and do it again. Now, you can do it about 10 repetitions, and it varies amongst experts on how many times you should do it in a day. Typically between 3 to 8 sets of 10. We used to say, do it in the commercials when you're watching television, but nobody watches commercials anymore. So you could think about it as breakfast, lunch, and dinner. You could think about it as stoplights on your commute, however you do it. But just like any other physical activity, if you don't do it, it doesn't work. So people will ask us all the time, is this going to work? Is there any evidence behind it? Well, we know some things. We know that the physical activity of this type will help urinary leakage. It will help you to leak less and even go less often if you find you're going very frequently. It can help improve your quality of life due to your urinary symptoms. So it is recommended by our national society. And a very high number improve, again, if you are hitting the target. So what if you can't hit the target, or when should you start? Okay, if you would like to prevent these things from happening, you can start while you're pregnant. If you want to treat, you may be able to start within a few months after delivery. If you're listening from overseas, instructions on this may already be part of your postpartum package. How long do you try on your own before getting evaluated to know if you're hitting that target? You can have the evaluation at any time. If you are doing the exercises on your own, and it's been about 12 weeks of a consistent routine, you probably want to go ahead and have an assessment. So what does that mean? There are physical therapists for your pelvic floor specifically. I bet you didn't know that one. There are specially trained people that can help you to find those pelvic muscles, to hit that target. If you have poor strength or poor endurance, if you are having issues with coordination of your breathing, or if you're not really making progress on your own. There's specially trained people, and there are resources online to try and help you find one, no matter where you live. The sessions could be 1 or 2 times per week, or every couple of weeks, typically for around 12 visits in the United States. And they can also help assess your back pain, your shoulders, how you lift, how you do things in your daily life. So I think it's very good education to just understand how you move in space differently after pregnancy and delivery compared to before. So in summary, pregnancy and delivery will forever change the foundation of your body and your core function. We cannot take you back to a pre-pregnancy and delivery state. So make that decision wisely. Issues are common after delivery, and many resolve or significantly improve at 1 year. So try and be patient and talk with your obstetrician gynecologist about your concerns. Healthy habits and exercises may help prevent and even treat many of these conditions. And there are providers with special training that can help. So I say this with the caveat that knowing all of this information didn't stop me. I've been in love with babies ever since I could say the word baby, since I met my baby sister and until I had my first daughter. I know that there can be joys of childbirth that extend past these issues of pelvic health disorders after pregnancy and delivery. So I understand, but I would like to pay it forward, as all of us in pelvic health would, to help other women who aren't so aware understand what the implications of their decisions are. So there are resources that can help if you're local. Our group sees patients in Palo Alto as well as Redwood City. We have multidisciplinary care in Redwood City, and that means for women who are also suffering from hemorrhoids, from bladder infections, from difficulties with intercourse. We have families of specialists and can help navigate you through that. This is our staff, and you can follow them on Twitter in their Pelvic Health Center. And we actually treat men as well. So men can also have pelvic health conditions. So if there's a man in your life too, please do find resources. Obstetrician gynecologist, no matter where you live. For us, we have practices in Palo Alto, Redwood City, and the surrounding towns. But no matter where you live, obstetrician gynecologists have visits called preconception visits. So they want to meet you before you embark upon your pregnancy to talk about these kind of things, about your specific goals and interests. And I definitely recommend having that conversation and establishing that relationship earlier rather than later. Thank you so much for tuning in this morning, and I'll be happy to answer any questions.
Thank you so much, Dr. Rogo-Gupta. And now, as she said, we will move on to the question and answer portion of our event. And please remember, our guest's advice is for the general population. Please do consult your own physician for advice that is specific to you or your family. So we do have some questions, but we have lots of time for other ones too, so do send them in. Can one expect some of the symptoms that you mentioned just to go away in time without any intervention?
Absolutely. We can absolutely expect many, if not all of the symptoms to go away with time. The one that tends to linger sometimes is accidental passage of gas. That's a tough one, so that one still may continue, but the other ones, such as the accidents of urine and stool, such as the vagina hanging low or that extra sense of pressure, absolutely can. And so hopefully you can talk with your obstetrician gynecologist about whether there's any concerning features or if you have any medical conditions that would make you at a higher risk or need to be surveyed more closely. But in the majority of cases, yes, a little bit of patience does a great deal of good.
And what is happening that causes the issues to resolve? Do the muscles get stronger? What happens that causes that?
Healing. Yes, the muscles and the nerves regenerate and they do heal. That's why setting yourself up for success in terms of trying to avoid significant straining after delivery, managing your weight and your diet, that can help take some extra pressure off because yes, you've just undergone an injury, right? You've had that injury experience. And if people had a different injury, if you threw out your back or you had a hip replacement, you wouldn't think twice about relaxing and allowing yourself to heal slowly. The problem is we don't think that way about delivery. We are trying to jump up, trying to resume all of our normal activities, yet we're in a period of healing. And especially in American culture, that there's a little bit of a disconnect there. So I like to inform women that yes, your body is in this phase of healing and nerves and muscles take time. Sometimes a year, right? Sometimes a little bit more for the nerves, we're finding out. So that's why if you just have that little bit of patience and allow yourself to heal because you're young and healthy, most likely by the chance that you got pregnant, right? Therefore, you will get there. It just takes a little bit of time.
And what do you mean when you say nerve damage? To me, when I hear about nerve damage, it always means I can't feel something. Is that what's happening?
Absolutely. So as an example, the nerves that stretch down to your anus, the hole where your stool comes out, those stretch well beyond the threshold that we know causes permanent injury in animal studies and in labs. So just by nature of being pregnant and having the larger abdomen, the larger distance from your spine where your nerves come out, and then having that pressure of the head, your nerves will stretch. And yes, not feeling anything, that lack of sensation. That's how sometimes leakage can occur. You don't even realize that your body is passing things through it. You don't have that level of detailed sensation anymore, the way you have like on your fingers or without nerve injury. So as that healing happens, your sensation will then return. And that's similarly why I say, you don't necessarily start the exercises on day one because you feel a little bit numb, because it's hard to engage. And so naturally, as you start to feel the sensation again, then you can engage. And then that's a great time to sort of ramp up those exercises at home.
You know, you've emphasized several times that if you're an American, what's the difference between, we have a kind of a global audience here, so what's the difference between America and other places?
You know, that's very interesting. Healthcare systems certainly vary from country to country. There are places in Europe, for example, where pelvic health is really emphasized throughout the pregnancy and then after delivery, where a pelvic floor physical therapist or someone with that skill set is visiting you after your delivery and teaching you these things kind of right away and how to integrate that. In other countries as well, there tends to be more family support in that immediate postpartum period to help you with the child rearing aspects of it. So the physical demands on your body are not as high. So in the United States, we certainly have many benefits to our type of medical care, but we're not perfect. From the pelvic health perspective, we really would love to see integration of more of these topics in the pregnancy and postpartum conversation. And we were thrilled to see the American College of OBGYNs update their recommendations to have more frequent interactions with the medical team in the immediate after delivery period, and to have joint goals, for example, returning to pre-pregnancy weight, for example, within a year. So we're really excited to see those advances.
Great. Here's someone who says, I'm 7 months pregnant, congratulations, and have had pelvic pain since I was 5 months pregnant. Does this mean I'm more likely to have issues after I deliver my baby? And this is also interesting, my OBGYN suggested a pregnancy belt. So do you have any other suggestions? So we've got 3 questions. I can help you keep track.
Thank you so much. That is a great question. So having pelvic pain during your delivery, so that implies, right, that your body is going through that stretch process, right, in a way that's painful, so in a severe fashion. So I definitely would think that that would be a reason for you to be more aware, kind of now, to definitely engage with a physical therapist, even during your pregnancy and then into after, because those connections, right, that are stretched, they're going to go through a process of returning to normal. And I would like to make sure you don't have further delivery, afterwards. The pregnancy belt. So I love a pregnancy belt personally. I wore them every day through my entire delivery and even afterwards, actually. Physical therapists have some different opinions, so you have to get examined, to be able to make that decision for yourself. But if you can imagine having that extra lift on your heavy abdomen, on that growing uterus, to help take a little bit of pressure off of your lower back and help make sure that you aren't changing the angle of your low back without realizing it. So I personally love the back support for myself, but certainly go ahead and get an assessment and make sure that that makes sense as part of your overall picture.
And I think you may have a picture of one. Is that possible on one of your slides? I'm going to pull it up and have you take a look on number 17.
Yeah.
So maybe.
So there's a few different styles and different goals. Some are called belly bands, so to speak, that are more like an elastic that some women will use, or they kind of talk about in terms of either awareness, so just so you remember that something is there, or in terms of the skin. But yeah, it's on slide 17. There's kind of sort of an example.
Okay.
So the one that is really guided for support is more similar to what you might see people wear, for example, heavy lifting, like in construction or in the big box stores where people are lifting like really giant, huge boxes. They have boning towards the back, and in the non-pregnant person, that boning kind of circumferentially through the front of the abdomen. When you're pregnant, there's a little cutout for that belly to sit on top of. That one can give you a little bit more support and really goes ahead and lifts the belly.
Okay.
Yeah.
And then other suggestions about pelvic pain that this person is experiencing, and other people maybe as well. Was there anything else to consider?
Well, your joints are going to be the biggest ones and the most important thing to look at, because you can get hypermobile joints. Some people will talk about separation between the 2 bones here, the pubic symphysis. So there's like a stretchy glue in between those 2 bones. And if they stretch too far, that can be a surgical issue. That can be a very serious issue. And between the 2 muscles, your abdominal muscles, your rectus muscles, something called rectus diastasis, where the muscles separate and they don't come back. There's a gap in between that doesn't necessarily go away. And so that's another thing that might need surgery, but might have some conservative options.
Talk a little bit about the surgery. I mean, I have people that I know that have had they're shoring up the bladder, they're taking care of things. Maybe you could just tell us with the idea that we want to avoid it.
Well, yes. Certainly there are options in between sort of nothing and surgery. There are those exercises like we had mentioned. There's also little lifts or shelves that we can help put inside the vagina to help lift things up and out of the way. The surgery typically involves finding some way to go ahead and elevate those again, to take the pressure off of the weak muscles that are no longer doing their job. It's using your own tissues or permanent material to stick around if there's the discussion that your tissues aren't strong enough. It may also involve looking for those muscles in those healthy tissues. As you saw, they start as a bowl that meets in the center. As you can imagine, once a baby's head, that reminder, maybe as large as a grapefruit, goes through those muscles, they may splay and be on either side. So your doctor may talk about reconstructing to find those healthy tissues on either side, bring them back to the middle so that then they can better support and function the way they're supposed to.
Thank you. After birth, I had some lower back pain whenever I squatted. Is that part of pelvic or nerve damage?
Absolutely can be. So yes, as you squat, so again, kind of that idea that those muscles stabilize the joints of the hips and from the pelvis to the back. So squatting is a big work on your core, and it puts a little bit of pressure on that pelvic floor. So absolutely, that's an example of how I say we sort of take for granted squatting and different types of activity before pregnancy and delivery, and then after delivery you realize, wow, this is actually really hard on my body. So absolutely, that is a great example of why learning some of these activities and these different types of strengthening exercises is important. I don't love for my patients, for example, to sign up for very aggressive core work where they're running or repeatedly having motion on pavement without kind of that awareness of what actually happens to your pelvic floor. Or, for example, doing a sit-up. That's a very common physical activity that a lot of people feel like they know what to do, and so they feel like they can do it on their own. But as you go ahead and crunch and think you're using your abs, I want you now to pay attention. Are you pushing down on your pelvic floor, or are you lifting it in? So knowing now that connection with your pelvic floor is important, because I don't want you to accidentally be pushing down on your weak pelvic floor right after you deliver.
Thank you. There are questions here about whether or not Kegels are recommended for non-pregnant women as well, even if pregnancy is not in the near future. Mm-hmm. So I will ask on behalf of everyone who may have not got it, because I didn't. What did you mean when you said hit the target?
So it's very hard to be aware of those muscles. It's really hard to get to your pelvic floor muscles. If it's not something you've ever thought about before, you may not realize that when you try and do that, you're actually squeezing your inner thighs together, or you're squeezing your abs, your six-pack per se, or squeezing your gluteus maximus. So the target, meaning the actual muscles that are that big bowl, the bowl through which, right, all must pass. That's actually why that question is a good one about women who are not pregnant, right? Or maybe aren't going to be pregnant. If those muscles, those exercises are designed for strengthening and coordination. If you haven't had an injury to that area, or you're not going to have an injury to that area, strengthening may not be what you need. Let me contrast that, for example, with women who have these similar symptoms, but maybe are athletes, right? You're in very good shape. You're a long-distance runner or something along those lines. You can have similar symptoms, not because you're weak, but almost because you are too strong, right? If you are too strong, then that coordination and, again, the feeling of squeeze and release, you can't quite, again, hit that target or squeeze and release these particular muscles because you're so used to working on all the other muscles that are in that location. So that's why I say that I really like someone to have an evaluation on the early side if they're thinking about whether these types of exercises are right for them. That's the trouble with medicine. There's not one prescription for everyone. Your lifestyle, your genetics, your age, all of this plays a role. So typically, I would recommend talking to your doctor first just to make that assessment for you.
Thank you very much. All right, this one is about C-section. So can you talk a bit about, I think this is how I say that, diastasis recti, and some resources for some recovery from it. I had a C-section and I'm suffering from it. My post-pregnancy tummy bulge is still quite a lot.
Yes, absolutely. Excellent question. And that's a very common question as well, because again, the extremes of pictures on social media and things and the expectation that your stomach returns to normal is for me, quite humorous because you're changing forever. So there are specific types of exercises that are focused, for example, on women that have rectus diastasis to make sure that you engage the other muscles that are part of this whole system. And therefore not, like I mentioned, accidentally overworking other parts, let's say. When you have diastasis, the rectus becomes weaker, right? And so the other muscles, like the low back, right, can overcompensate, and you can end up getting back pain. The physical therapist, and it doesn't necessarily actually need to be a pelvic floor physical therapist in this particular situation, but a lot of times women like seeing female physical therapists. You can definitely choose, but they may have some more customized types of exercises that you can do on the floor as well as standing, etc. That can help with that. Otherwise, the only other option tends to be surgical to go ahead and bring those muscles back together. But typically we don't recommend that until you're completed with your childbearing for obvious reasons. You don't want to go and repair it and then have another injury with another pregnancy. So the most that you can do for your rehabilitation early would be great to get you through those years that you're going to plan on childbearing.
So are there any other things we can do postpartum to get things back to normal besides Kegels?
I think that returning to a healthy weight and getting your bowel movements under control is a really important one. In our world in pelvic health, what tends to happen is these issues sort of become forgotten. Life gets really busy. You're dealing with the baby, you have the interpersonal issues with your partner, you may or may not have work at home or outside the home. There's a lot that happens in those years. And women tend to put their own health care last. And then they can escalate. These issues can silently escalate in the background until your symptoms are so severe, then you are talking more towards surgery. And for us, that tends to be bowel movements, actually, because with that slight lack of sensation, and the fact that you are rarely in the bathroom by yourself again once you've had children. Sorry to let you all know that ahead of time, little sneak peek. So you're rushed, you don't really have your same schedule as you did before. But women tend to not have their normal toileting habits. They'll tend to get backed up more, they'll tend to strain more, and pushing and straining over time. That adds up. And so then 10, 15, 20 years later, they have things hanging low, so to speak, because they've essentially pushed them out. So for me, I really talk about bowel movements and getting back to that normal weight, everything that we're trying to do to decrease the pressure again in this postpartum time and in that healing time, just to try and set us up for success. There's also a talk about the inter-pregnancy interval. So we're now starting to have pregnancies later and much closer together than earlier generations. And if you go back to that use injury conversation again, do you want to then injure yourself again before you're fully healed? No, a professional athlete wouldn't do that. Why do we do that to ourselves? But because of all the other pressures, it happens. So your obstetrician gynecologist will talk to you about perhaps waiting at least a year in between those pregnancies to allow for that healing to happen.
And this one just in, after delivery of a C-section, I got an IUD inserted. Are Kegel exercises recommended with an IUD? And multiple pregnancy affecting pelvic health compared to a single pregnancy. Let's start with that IUD question.
The IUD question. So I commend you for using a long-acting reversible method of contraception. It's quite reliable. So yes, you absolutely can do the Kegel exercises with the IUD in place. It sits inside your uterus. And the uterus may sit on top of this bowl of muscle, but they're not directly connected per se. So you activating those muscles will not increase your risk of expelling the IUD or any malpositioning or malfunction. So you absolutely can. And the question about multifetal pregnancy. So yes, that is obviously our multifetal pregnancy rate is increasing compared to prior generations. And you know, you are carrying more weight overall, potentially for a less time, depending on the complications or lack thereof in that particular pregnancy. But yes, it is more weight on your system, right? I think when you have a multifetal pregnancy, you may already have experienced, right, maybe some more abdominal, low back pain. So I want you to think about the same conditions that I talk about, but perhaps at more risk. I couldn't quote you exact numbers per se because the multifetal pregnancies, you know, in such a high volume are relatively new in the span of humankind. And we always like to follow people out as long as we can before we give some of that feedback. But I definitely think that you should be aware of this if you have had or will have a multifetal pregnancy.
I know you probably have so much advice, but what would you like to leave us with today? I remember somebody once said to me, you know, you need to take the same amount of time to lose the weight as you took to gain the weight. But I mean, what is and are some of the most important things we should remember on this topic?
That's a great question. Well, I think definitely one of the most important things that you should remember is that this decision is very serious. It's an exciting, it's an emotional, it can be a very positive experience, expanding your family. And I don't want to create too negative of a picture in sort of telling you the truth behind the curtains. But I really hope that this information you can use to empower yourself to have those conversations early and to help make this as smooth of a transition as you can. I think the knowledge and the notion that babies aren't free, that you'll be changed forever, and that natural doesn't mean risk-free is really important. And that can be okay if you choose, right? But I hope I haven't been too negative, but I would like to encourage you just to have that conversation and to have that knowledge, and hopefully you'll be as successful in your pregnancy and your delivery as you have been thus far to make it here today.
Don't worry, Dr. Rogo-Gupta. You show those pictures of the baby, there's nothing negative at all. So No worries there. Thank you so much for all the great information. I'm Mary Windishar, and on behalf of Dr. Rogo-Gupta and our team here at Stanford, thank you very much for joining us.